Hello everyone, my name is Feng, and I'm currently a rising senior at Seattle Academy. And today I'll be presenting my research exploring the long-term cognitive effects of general anesthesia. So general anesthesia is medical treatment that prevents patients from feeling pain during surgical procedures. Although the use of general anesthesia is safe and widespread, there are still concerns regarding its potential long-term impacts on the brain, such as cognitive decline or neurodegenerative diseases. So this study aims to assess whether there is an association between the use of general anesthesia and the risk of cognitive decline in neurodegenerative diseases, and primarily focusing on the impacts of tau protein. Just a little background on tau protein. So basically, it's a protein that helps stabilize the internal skeleton of neurons in the brain, and it is closely associated with the cell's cytoskeleton. So abnormal function of this protein might lead to the failure of nerve cells and neurodegeneration. And there are T-tau and P-tau. So T-tau stands for total tau, and it basically refers to the measurement of all the tau proteins in the brain. And p-tau stands for phosphorylated tau, which specifically refers to tau proteins that have undergone a process called phosphorylation, in which phosphate groups are added to the protein. It's a normal regulatory mechanism for many proteins, but however, abnormal or excessive phosphorylation of tau might lead to also called hyperphosphorylation, can disrupt tau's normal function and can cause the protein to tangle up, which could lead to failure of nerve cells and neurodegeneration. And that leads to my research question: how does abnormal tau functions induced by general anesthesia affect the risk of developing long-term postoperative neurodegenerative diseases like Alzheimer's disease? My hypothesis is that the abnormal tau functions induced by general anesthesia may increase the risk of developing long-term postoperative neurodegenerative diseases because abnormal tau function is a characteristic feature of neurodegeneration. And the methods I used are a literature review of existing medical studies on the correlation between general anesthesia and tau levels, and the correlation between tau levels and neurodegenerative diseases. Also comparing graphs and data from different studies. So first, I looked at studies on the exposure to general anesthesia and tau levels. So on the left is a single-center study focused on patients ranging from 60 to 85 years old who received major cardiac surgery with general anesthesia. They measure the tau levels of patients preoperative and postoperative, and they found that tau level was significantly higher in the postoperative stage, as you can see on the graph. And on the right is another study focused on mouse models. The study exposed mice to human tau protein, and they compare the tau levels between the control group, which had no exposure to anesthesia, and the experimental group, which was exposed to anesthesia 3 months before data collection. And they found similar results, which is that the tau levels in the experimental group were significantly higher than that of the controlled group. So both studies found similar results, which means that there is a high risk of increased tau levels post-anesthesia. So next I looked at tau pathology and its relationship to neurodegenerative diseases. So here's a diagram of the pathological changes of tau in Alzheimer's disease as time progresses. So you can see that tau pathology in the preclinical phase was much lower than when patients were diagnosed with dementia or even just mild cognitive impairment. This is a study that, This is a study that measured tau levels in patients with various neurodegenerative diseases. The highlighted ones are all neurodegenerative disease, with the red one being neurodegeneration with increased tau, and the green ones being neurodegeneration with normal tau levels. And you can see that most of the neurodegenerative diseases do have higher than normal tau levels. So this is another study similar to the previous that also measured the tau levels of 24 patients diagnosed with different neurodegenerative diseases. And the results are also similar, with the control group on the very right having the lowest tau levels, and the group with Alzheimer's disease and dementia on the very left having the highest. So basically, these studies prove that neurodegenerative diseases are associated with higher tau levels. However, when you kind of zoom out and look at patients previously exposed to general anesthesia and the percentage of them actually getting neurodegenerative disease, there is no obvious association found. So on the top is a study that analyzed about 900 cases of dementia. And each case was matched with a corresponding control who did not have a diagnosis of dementia. And they found that a total of 70% of the dementia patients had been exposed to general anesthesia, compared with 72.5% of the control group. So there isn't like much a difference between the percentages, which means that there was no significant association. On the bottom is another research that studied a total of 115 Alzheimer's disease patients, and each case was matched with 4 controls, and their medical history, including exposure to general anesthesia, was examined. And again, no associations were found between Alzheimer's disease and exposure to anesthesia. Just a summary of all the results so far. So multiple studies have proved that exposure to general anesthesia will increase tau levels, and it is found that patients with neurodegenerative diseases, especially Alzheimer's and dementia, do generally have higher tau levels, as well as increased hyperphosphorylated tau. However, no direct association was found between exposure to anesthesia and neurodegeneration. And that leads to my conclusion, which is the increased tau levels induced by general anesthesia are insufficient to generate enough hyperphosphorylated tau to directly cause neurodegenerative disease. However, since the tau levels did increase a considerable amount post-anesthesia, future research is definitely needed to determine if other contributing factors come into play, such as like different levels of exposure to general anesthesia and how would different age groups affect them, and also the type of surgery, like what's like their relationship. And yeah, here are my references. And thank you, SSF. Thank you, Dr. Peer, physicians, listeners, and my fellow interns. Any questions?
I think that was a really interesting topic. I hadn't heard much about tau proteins with general anesthesia. It's certainly something to think about, so thanks for illuminating that for us. So what do you think the best way going forward to further investigate this topic would be for you as you advance in your medical career?
I think like definitely doing like more research on this topic, because it is a fairly new topic that needs there are still a lot of things that we don't know about this yet. So definitely look into some of the questions like on my last slide, like how would other contributing factors affect this protein, and yeah.
Thank you.
Yeah. Thank you.